we have a lot to get to this morning. We want to begin with new updates on mask mandates. After a request from the CDC on Wednesday, the Justice Department is now appealing the ruling that struck down the federal mask mandate when traveling on planes, trains, and buses. The CDC saying at this time, an order requiring masking in these areas remains necessary for the public health.
Yeah, to help us out with some of the confusion behind this back and forth, we brought in our expert, NBC News senior medical correspondent, Dr. John Torres. Dr. John, great to have you. You know, people are confused out there. I mean, this sort of whiplash with the masks on planes and trains, it's getting people really a little upset. But you have some great advice for people, right? What should they do? Should they wear the mask? Should they not wear the mask?
So first and foremost, remember, we're still in a pandemic. It hasn't ended yet. Cases are actually going up because of this new variant that's out there. And so you want to be careful. And I tell people all the time, if you're in that young adult group where you are perfectly healthy, you don't have to worry about it a whole lot. But at the same time, you know, think about wearing a mask and certainly carry one with you because you might need it in different areas. But if you're in one of the more susceptible groups, you know, over 65, immunocompromised, children who can't get vaccinated, or those who are not vaccinated, then you want to think about wearing a mask, especially if you're on public transportation. With planes, not as big as an issue because we have that kind of 2 to 3 row area that seems to have good ventilation, and there seem to be protected beyond that. But at the same time, you never know who's sitting next to you or who's going to board. It could be somebody that's coughing and sneezing the whole time and not putting a mask on. You'll want a mask in that case. But it could also be somebody who's asymptomatic and spreading it. So just be very careful. I'm still wearing my mask. I'm still going to continue to wear my mask. So the other thing I tell people all the time is just be courteous. It's okay if I wear a mask.
Right, exactly. I've been on the New York City subway on a warm day. There is no air sometimes in some of these subway carts. Is there any kind of air circulation on trains, on buses?
You know, Dylan, you bring up a great point because we always talk about the airplanes and the great ventilation and how you're protected there. Not the same for buses and trains because the ventilation is not the same. So you have to think about the car instead of just a couple rows. And so in the car, could somebody be spreading it? Could somebody be sick, visibly sick? Yes, you definitely want to protect yourself. Could they be asymptomatic and spreading it at the same time? I would still wear a mask if I'm on public transportation, especially as cases are going up and you can look in your area and see where they are. If they start rising, then definitely put one on.
In Philadelphia, as you know, they just reinstated the indoor mask mandate. I mean, if we continue to see the case counts rise, is that something we should anticipate more of?
And I tell people all the time, hold on to your masks. Do not get rid of them because you're going to need them at some point here in the near future. And the CDC has set off their guidelines for the low, medium, and high areas. Turns out New York County here in Manhattan is medium. And so they're saying if you're immunocompromised, talk to your doctor about whether you should be wearing a mask. If we get to the high range, they're going to recommend indoor masking for everybody. And so you can see that happening because, again, cases are going 40,000, getting close to 50,000. They might start rising across the country, in which case they might say, let's do this for a couple of weeks, and that's okay.
So on Tuesday, the CDC alerted us about this new sort of Omicron variant. Is this the same as BA2, or is this something completely separate?
So this is a sub-variant, and it's actually a sub-variant. So if you remember, Omicron had BA1 and BA2. This is a sub-variant of the sub-variant BA2, and it's BA2.12.1. So it's very.
This is just getting ridiculous.
So he's like third cousins with Omicron. So,
what I tell people, it's like siblings, but in this case, it's almost like twins that have more genetic predispositions and genetic similarities with a few differences. We do know it spreads a little easier, 25 to 30% easier spread, but it doesn't seem to be any more dangerous, doesn't seem to be able to get around the vaccines any more than Omicron does. So that's the good news.
That is good news. Dr. John, thank you for that.
Thank you, as always.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.